Hello and welcome. During today's lecture, we will be discussing environmental health and bioterrorism in community health nursing. Through our discussion, we will gain a better understanding of how the environment can affect the health of communities and populations. This not only includes where we live, but also where we work and/or where we spend our leisure time. We will briefly discuss specific agents such as anthrax, which are involved in bioterrorism attacks, and the role of the community health nurse in disaster planning and disaster preparedness. I think you'll enjoy today's lecture. Environmental health. Environmental health is defined as a field of public health science that focuses on how the environment influences human health. This comes from your textbook, page 378. Now we move on to the history of environmental health. Although people were starting to realize the impact of environmental contaminants on the ecosystem, for example, in the way that plant species and animals were disappearing, they did not have the knowledge of how to deal with the contaminants, in part because there were no environmental regulations. At that time, it was common practice to bury trash or waste materials into ocean, lakes, and rivers. Now, not only did they not know how to properly dispose of the waste, but they had no idea the effects it would have on health. Materials such as plants, metals, litter, human sewage, and organic pollution were being dumped. The slogan of that era was, the solution to pollution is dilution. In 1969, the Cuyahoga River caught fire. This was because of the vast amount of oil and debris that had been dumped into the river from surrounding industries. It was caused by a spark from a railroad car going over a bridge over the Cuyahoga River. The spark ignited the oil and petrol that were on the surface. This incident brought about increased public awareness to how human actions can impact the health, and it raised concern for further investigation and regulation into the pollution problem. And just as some trivia related to this, you may have heard of the Burning River Girls, their roller derby team out of Cleveland, and they were actually named from this incident. And the Great Lakes Brewery actually brews a beer called the Burning River Beer. Just a little fun added trivia. I have attached an article this week in our weekly content about environmental pollution. This is something that I found in the newspaper back in March of this year, and it's related locally to where I live. So please read over that. It's just a brief article, and then go ahead and take a look at the YouTube video that's in this slide. Environmental regulations and laws. In 1970, the EPA, or Environmental Protection Agency, was created by the federal government. It was born in the wake of the heightened awareness about the environmental pollution. The regulations rose out of the ashes, so to speak, of the Burning River incident. The EPA had a daunting task of attempting to undo all of the previous environmental damage and establish new criteria for maintaining safe, clean water, air, and land. The overall goal of the EPA is to promote a healthier, cleaner environment for all Americans. Environmental laws were legislative acts that were formed during the 70s and 80s to enforce environmental health and protection. These laws included, number one, the Clean Air Act, and this was for the regulation of air pollution. The Clean Water Act, which is for improving the water quality and regulates the amount of pollutants dumped into U.S. waters. And the third was the Superfund Act, and this was established to address abandoned hazardous waste sites. The Superfund program is responsible for cleaning up some of the nation's most contaminated land. Environmental risks. What are the environmental risks? Environmental risks to health include toxins such as lead and pesticides. Air pollution risks include things such as carbon monoxide, the ozone, and tobacco smoke. Water pollution risks include wastes dumped into water sources, erosion of land after mining, and chemical runoff from farming and industry. Assessment. In the previous slide, we mentioned the environmental risks that include toxins, water, and air pollution. Now we need to determine who is at risk. Essentially, the risk assessment determines the risk or likelihood that illness or disease will occur in a group due to exposure to an environmental contaminant. How is risk determined? Risk is determined by using the risk formula. The risk formula is risk equals hazard plus exposure. No exposure to hazardous material, no risk. Risk assessments are done in some communities to establish the risk of becoming ill from an exposure to a hazardous material. Just the presence of a hazardous material alone does not determine the risk. The person needs to be exposed. Again, the risk formula is risk equals hazard plus exposure, and I'll give you another example on the next slide. The following is an example of determining risk using the risk formula. In the example, the risk is skin cancer or sunburn from the hazard, which is exposure to the sun. If the person applies sunscreen or a hat and still goes out into the sun, then they are still exposed or at risk to the hazard, which is the sun. However, the exposure would be reduced if the person stays indoors during peak sun exposure times, which are 10 to 2 p.m. Then they are eliminating the exposure to the hazard, again, which is the sun, and there is either no risk or they have greatly reduced that risk. Remember, exposure needs to be present in order to be at risk. No exposure, no risk. We have determined the risk. Now we will explore the route of exposure to environmental toxins. To assess exposure, the exposure pathway is used. This is a process by which people are exposed to an environmental contaminant. Some of the most common sources of contamination are from lead, mercury, mold, anthrax, asbestos, and radiation. Next, the danger of exposure is related to the environmental medium in which the contaminant is present. The environmental medium refers to soil, groundwater, and air. The point of exposure is just as described, the point in which people come into contact with a contaminated medium. This could be at home, the park, or even in the food that has been consumed or eaten. The route of exposure refers to how the contaminant enters the body, such as ingestion, inhalation, or skin contact. Lastly, the receptor population are those most likely to be exposed to the contaminant. Thus, the public health nurse would need to consider if the client is currently being exposed, has been exposed in the past, or will continue to be exposed to the contaminant in the future. This is often done through an exposure history. We will discuss that in an upcoming slide. Check out the website listed on this slide. You can type in your zip code and find Superfunds in your community. This slide provides a good example of an exposure pathway. Can you find the following? The source of contamination. 2. The mode of transport or media. 3. The point of exposure. 4. The route of exposure. 5. The population exposed or the receptor population. The exposure pathway is an important key concept to know and understand. As mentioned earlier, an exposure history is done in an effort to determine who is currently being exposed to the contaminant, who has been exposed in the past, or who will continue to be exposed to the contaminant in the future. It is a process to identify the current and past exposures. Some of the questions related to the health history are related to present work, past work, home or residence, activities and hobbies, or concerns about the status of health. Read over page 396 of your Harkness and DeMarco text, where you will find a list of questions that can be asked during an exposure history. You will also find information listed in your ATI booklet on page 20 under Key Questions of Environmental Health History. On this slide, you will see some sample exposure history questions. The I prepare is a mnemonic that is useful in determining current and past environmental exposures. It is found on page 19 of your ATI text booklet. Please read over this and understand it as you may see it in your ATI exam. Nursing interventions and evaluation. Planning interventions to address environmental health issues are similar to planning any other nursing intervention. The community health nurse is involved with developing interventions to protect and improve the health of the community. The interventions are geared towards interrupting or breaking the exposure pathway. The community needs to have input in deciding which interventions will assist in making the community's environment safe and healthy. This concept promotes the knowledge and awareness in the problems at hand and engagement in finding a solution. The evaluation of interventions determines the effectiveness of interventions established to halt the exposures, and it may also promote an increased awareness to the problem at hand. Read over the example from your textbook on page 397. Health and the environment. Environmental epidemiology is defined as the field of public health science that focuses on the incidence and prevalence of disease or illness in a population from exposures in their environments. There are some challenges associated with environmental epidemiology. Often, it is difficult to determine the incidence and prevalence because one group within a population may be exposed to the contaminant, yet another group within the same population may not be exposed. This limits the data available on contamination and the effects on health. Other challenges include time, resources, and latency period. Environmental justice. When we discuss the incidence and prevalence of exposure, there are populations who are more at risk than others to the negative environmental health consequences. Now enters the concept of environmental justice. Environmental justice is defined as the belief that no one group should bear the disproportionate share of negative environmental health consequences. The question is, who bears the burden? Poor and minority populations bear the burden, such as the victims of Hurricane Katrina. Before Hurricane Katrina hit the city of New Orleans, levees had been neglected that protected the city from flooding during a storm surge. This was done in an effort to put money towards growth and development of the city and not taking into consideration that the levees may someday fail. Unfortunately, the storm hit, the levees failed, and who was left to bear the burden? The economically disadvantaged were the most vulnerable. Who else bears the burden? Farm workers who are exposed to pesticides and live near farm areas, and tribal communities. I encourage you to read over the examples of environmental justice in your textbook. Global environmental health challenges. Environmental health challenges are felt globally. Health concerns in one country can have effects on another nation. Pollution may occur from the contamination of air, water, and land while producing goods for another country. This can have global consequences. An example is China. The Chinese government has little regulation and has a high incidence of air pollution. The nation produces goods for the U.S. and other countries. This production of goods results in the pollution of air, which is so bad in China that the outdoor air quality has reached the equivalent of breathing air that is the same as living inside a smoking lounge. Improving air quality and reducing toxins has the potential to decrease illnesses such as asthma, cancer, and heart disease. Although the effects of climate change are still being researched, most scientists agree that human activities are influencing global climate change. Climate change has been proven to impact our weather patterns, leading to increased natural disasters, which have a direct effect on human health. How, you may be asking? Well, the changes in the environment can lead to the contamination of food and water, or limit the resources and facilitate the spread of disease. Clean water and sanitation, something we take for granted in the U.S., but there are millions who lack the access to adequate sanitation. This is an interesting image. It ties in the concepts of how air, water, land pollution, and climate change all affect health. Please go ahead and watch this YouTube video about clean water and sanitation in the Philippines. Watch carefully. You'll be able to relate many concepts we have learned previously as well as the current topic throughout the video clip. When you're done watching, I want you to consider the following. What organizations were involved in the global health effort? You might notice that it's the World Health Organization, UNICEF, the Department of Health, and local governments. Number 2, was there any health planning? Are they trying to replicate this program in other communities? Who are the stakeholders? What are the levels of change according to Lewin's model? Unfreezing, refreezing. The third thing to consider is the client as the community, forming communities of solution. 4, communicable disease, preventing the spread of cholera. 5, the epidemiologic triad, describe the host, agent, and environment. And 6, you will notice that there are disparities, socioeconomic, resources, and education. I think that you'll be able to find all of these in the slide and or in the video. So, please enjoy. Okay, moving on to community health nursing roles. Community health nurses play many roles in the environment, in environmental health, such as community involvement and public participation. They advocate for the communities. They provide referrals and resources. They do individual and population risk assessments to find out the community's needs. They're involved in epidemiological investigations and involved in policy development. All right, moving on to disasters. Disasters require the swift action of healthcare professionals and public health officials. There are 3 types of disasters: natural, accidental, and terrorists. Environmental disasters could be accidental. Oil spills are another example of an accidental disaster. Forest fires can be accidental or natural, such as lightning strikes or extreme hot and dry conditions. Notice in these pictures of disasters that I left out a picture of my kids' bedrooms, which would be considered a natural disaster. All right, disasters are often unforeseen, serious, and unique events that disrupt essential community services and cause human morbidity and mortality that cannot be alleviated unless assistance is received from others outside the community. Disasters cause human suffering and demand more resources than are available for the community. As mentioned in our first slide on disasters, there are 3 types of disasters: natural, accidental, and terrorism. Natural disasters can be widespread and negatively impact the economy, environment, and health. Many natural disasters are not predictable. However, advances in technology have enabled us to become more prepared. Examples are hurricanes and earthquakes. Accidental disasters occur due to circumstantial factors such as road conditions, human error, and physical deterioration of structures or buildings. An accident implies that it was uncontrollable. Epidemiologists have over time identified ways to prevent the negative outcomes of accidental disasters. How? By improving preparedness, awareness, and educational training. Examples of accidental disasters include train wrecks and bridge collapses. Terrorism is the use of violence and intimidation in the pursuit of political aims. It is any action intended to cause serious death or harm to civilians with the purpose to intimidate. It impacts the economy and the environment. Some examples are the 9/11 attacks and the Boston bombings. Let's now turn our conversation towards disaster preparedness. The disaster management timeline is also referred to as a life cycle of the disaster. It is important to know and understand the distinct phases of the timeline or cycle for the future. In other words, you should probably know this. Consider what actions are taken during these phases that affect illness, injury, and death, and that occur following an incident. And some of this is coming from your textbook on page 410. In the pre-impact phase, this is when the disaster is being forecast, early warnings are being put out, and people are being alerted or evacuated. During the impact phase, this is when the disaster is occurring or the storm is occurring. There's close monitoring, establishing emergency communication, and deploying of rescue teams for the disaster plan. During the post-impact phase, medical care is being provided, providing food, water, and shelter for those that are rescued, and repairing and restoring what has been damaged. Practice question. The Weather Service warns that there will be strong winds, heavy rain, and flooding. This may have devastating effects on the community. Public health officials and nurses are mobilized to establish shelter for those who may be left without. This impending crisis will affect the community. The response to this is considered which phase? Would we be in the pre-impact phase, the impact phase, post-impact phase, or the panic phase? In this scenario, we are looking at the pre-impact phase because there are warnings that are being put out, forecasts, early warnings, alertness, and evacuation. In another scenario, what about a tornado that has already touched down? Rescue teams have been deployed. Now what phase would we be moving into? Think about that. In addition to the disaster management timeline, there is the disaster management process. You will find this image in your Harkness and DeMarco text on page 411. Preparedness. This is identifying all hazards or dangers before the disaster occurs. This is the first step in planning for an effective response. During this phase, the most vulnerable groups are identified, such as those most likely to suffer death, injury, or property loss, and it identifies resources that would reduce the impact. In mitigation needs to start prior to the disaster by taking measures to limit damage, disability, and loss of life. An example of mitigation is the installation of a generator to be used during a power failure, thus limiting the probability of a disaster for some, or disastrous consequences for some. Response. Disaster response starts at the local level. At this level, disaster management plan is implemented and responders are deployed. Emergency care is provided. response also includes minimizing, improvising, and restoring transportation and communication systems, as well as providing food, water, and resources to those affected. After large storms, you may have seen a convoy of utility trucks on the highways heading out to the disaster-stricken area in response to the disaster in order to restore those communication systems. Recovery is the stabilization of the community and the return of the area to its previous state. And evaluation. Local emergency response committees analyze specific aspects of the disaster plan and assess the effectiveness, meaning the strengths and weaknesses of the response. This starts during the recovery phase. Disaster response. The agencies responsible for disaster response are the Federal Emergency Management Agency, also known as FEMA, the CDC, the U.S. Department of Homeland Security, the American Red Cross, the Office of Emergency Management, and Public Health Systems. These groups are responsible for asking the following: how many people are affected? How many people are injured or dead? How much fresh water and food is available to the victims? And what are the areas of risk or sanitation problems? These agencies classify disasters according to type, level, and scope. In the event of a federal emergency, the National Response Framework is activated and is responsible for maintaining and organizing disaster response. The role of the public health nurse in disaster management. The roles include assess the needs of the community, conduct surveillance for communicable disease and unmet needs. They prevent and control the spread of the disease. They maintain communication channels to ensure accurate dissemination of information to colleagues and the public, and organize and manage points of distribution centers and mass immunization sites as required. Look to page 87 and 88 of your ATI text and pages 415 of your Harkness and DeMarco text for more information on this. If we look on the third role of the public health nurse, maintain communication channels. The communication plan should provide access to emergency agencies such as the Red Cross and the state and federal government agencies. In addition to the content on the slide, nurses bring a certain characteristic to the table, such as being calm, creative, and responsive to emergency situations. The roles of the public health nurse continued, and these are to provide on-site triage as needed, manage behavioral response to stress, ensure the health and safety of the self, colleagues, and the public, and document events and interventions. Disaster training. Public health nurses have opportunities to practice disaster plans and assert themselves in response to planning and disaster management. This is done through just-in-time training. There are some benefits to just-in-time training. Just-in-time training is given immediately before it's used. Therefore, it shortens the gap between when the learning takes place and the actual application. Because of this, little resources are utilized or needed, making it more cost-effective. Unfortunately, some nurses fear that they do not have the skills to function in a disaster situation, which could be considered a deficit of any disaster training, along with the just-in-time training. What is bioterrorism? Bioterrorism is an event that involves the intentional release of viruses, bacteria, fungi, or toxins from living organisms into the environment for the purpose of causing illness or death. A biologic agent can be air or waterborne and can be inhaled or ingested. Clues to a biologic attack. These are found in box 20.7 on page 421 of your Harkness and DeMarco textbook. Some of the clues include case clusters of similar clinical presentations and timelines, case clusters of unexplained illness, disease unusual for a given age, disease unusual for a given season, and increased reports of deaths in animals. There are some distinct advantages of using biologic agents versus chemical agents. Why? The incubation period of agents afford the terrorists time to leave the scene of the crime before they are detected, whereas the release of chemicals is almost immediate and highly detectable. Again, this comes from your textbook, page 419. Biological agents, delivery mechanisms. Subcutaneous anthrax can be spread through direct contact. Airborne or nuclear agents are a form of simple dispersal. Biological agents can be spread through our food or water and droplet or blood contact. Categories of bioterrorism agents. Biologic agents are divided into 3 categories. Category A, B, and C. Let's look to the next slide to discuss the characteristics of each category. Category A agents are the highest priority agents, posing a risk to national security because they are easily transmitted and have high mortality rates. In your ATI book, page 89, this information comes from. The symptoms of anthrax attack are headache, fever, muscle aches, chest discomfort, severe dyspnea, and shock if inhaled. Treatments and prevention include IV ciprofloxacin or Cipro prophylactically, so prophylactic antibiotic for the exposure or high risk, those of high risk exposure. However, just know that antibiotics do not stop the progression of the disease, but they are given. Category B agents, these are the second highest priority because they are moderately easy to disseminate and have high morbidity rates and low mortality rates. Some of the agents include Salmonella, E. coli, typhus fever, water and safety threats such as cholera. These are easily available and they are reproduced and spread very easily. Category C agents. These are the third highest priority. These agents are easily engineered for mass production and dissemination, and they include emerging pathogens. They have a potential for high morbidity and mortality rates, and these include the nymphovirus and hantavirus. Chemical disasters. Unlike biologic agents, which require an incubation period before symptoms appear, a chemical agent, when released, makes its presence known immediately. An example are explosions or chemical spills, which can be accidental, such as the Exxon Valdez oil spill, in which 11 million gallons of crude oil was spilled. Chemical disasters affect people and the environment. Decontamination can be difficult. Ideally, it should occur as close to the site as possible to prevent the further spread. Hospitals receiving contaminated patients may establish an area outside the hospital to decontaminate before entry. Chemicals may cause burns. These would be blistering agents. They may cause difficulty breathing from choking agents or lung toxins. And nerve agents are known to induce convulsions. So those are just some of the symptoms and causes of chemicals. The role of the nurse. In a bioterrorism attack or accidental chemical disaster, the nurse needs to respond quickly. Always remember that protecting yourself is the priority in these circumstances, putting on that personal protective equipment. Nurses and public health officials can gain skills through community-held disaster response training programs, disaster simulations, some are held at the main Kent campus, or independent training programs such as FEMA courses or Ohio Emergency Management Agency training courses offered all over Ohio. The course can be taken free of charge for eligible students if you're interested, and their website is listed in the resource slide if anyone would like to pursue that avenue. I hope you enjoyed today's lecture and finding out about environmental health and bioterrorism and the nurse's role in this community health. Thank you. If you have any questions, do not hesitate to see me, and have a great day.